We need to ensure the whole world is vaccinated.
It will be a public health disaster.
The promise of equitable access is at serious risk.
How is the global COVID-19 vaccine program going? You may have heard about the rollout in your own country, but COVID is global, and there are concerns that poorer countries are being left behind.
How many diseases, how many epidemics, how many pandemics should the world go through until we realize that it's one world, that what hurts one people in one country hurts the other?
This moment was a milestone. I remember the picture. On the 8th of December 2020, Margaret Keenan became the first person to be vaccinated with the Pfizer vaccine. Since then, the largest global vaccination program has begun. Much to be celebrated, but some countries are already seeing unequal access to the vaccine. This map tracks jabs from country to country. You can see we're on more than 300 million single doses at the time of recording. That's been given in at least 129 countries around the world. But the vast majority have been in high-earning countries. Around half of the doses given so far are in the United States, the European Union, and the United Kingdom.
I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries.
Despite early promises that the vaccine would be distributed fairly, a global race is well and truly on. Looking at the numbers by population vaccinated, Israel is in the lead. They have a rate of 93 doses per 100. That means more than half of the population have already been given a single dose and 40% are fully vaccinated.
But there's been criticism that people living in the Palestinian territories haven't received anything near these amounts and so haven't kept up a similar pace.
In second place, the United Arab Emirates. They rolled out the second fastest vaccination program to their population of nearly 10 million, giving around 6 million doses of a vaccine backed by the Chinese government. And in third place is the United Kingdom. More than 20 million doses have been given to the most vulnerable groups. The UK government plans to offer a vaccine to all willing adults by autumn 2021, and currently they're on track to deliver on that promise. Those are the success stories, but the vaccine rollout lags behind in less wealthy countries. South Africa has had the highest number of COVID-19 infections in Africa, but chose to suspend their vaccination plan for the Oxford AstraZeneca vaccine after a small trial suggested it may offer less protection for a mutation originating in the country. They have now started vaccinating their population after receiving 80,000 doses of the Johnson & Johnson vaccine, which is expected to be effective against the variant. It looks bleak across Africa. Barely any doses have been administered in a continent home to 1.3 billion people. The Philippines, with a population of more than 100 million people, have administered just a few thousand doses so far. The government hopes to secure at least 148 million vaccine doses and inoculate 50 to 70 million Filipinos. Thailand has started a nationwide vaccination program for 70 million people. The Southeast Asian country has vaccinated less than 10,000 people so far. This slow start to vaccination in less developed countries is worrying some experts, and it's all down to a global competition and limited supply.
We need to ensure the whole world is vaccinated. And to do that, we have to release the intellectual property around vaccines. We have to upscale production in low and middle income countries. This idea that the vaccine's produced in Europe and the US and North America and then just gets exported to these countries. Why? That's so expensive. It's a really costly way of doing things. Countries in low and middle income countries have great capacity to manufacture these vaccines and deliver them to their populations.
Nearly 8 billion doses of vaccine have already been contractually reserved. That's enough to cover half the world's population if they were distributed evenly. But they won't be. Like the first 300 million doses, deals have already been signed with pharmaceutical companies by richer countries. They've been accused of vaccine nationalism. That is, getting their own populations inoculated first before others.
So you see countries like the UK and the US have bought up many vaccines, this question of vaccine hoarding. I know Boris Johnson said, okay, don't worry, once we've vaccinated everyone, low-income countries can have our leftovers effectively. Now, that is just preposterous, because we could all be vaccinated here in the UK. But in that classic comment around COVID-19, no one is safe until we're all safe.
We've seen this before, when just over 30 years ago, a highly successful antiretroviral treatment for HIV was made in the United States. The death rate for AIDS fell by nearly 50% between 1996 and 1997. At the same time, sub-Saharan Africa had a much bigger population of people infected with HIV. But it took more than 6 years before the life-saving treatment was available to many there. More than 12 million people died in Africa from AIDS-related complications in a decade, even as deaths went down in the US. With poorer countries already getting fewer COVID-19 vaccine doses, are we at risk of repeating the same mistakes?
The virus doesn't recognize borders. The virus doesn't travel with passport. So whatever you do in your country, even from a selfish point of view, is not really enough for your country.
But there is a scheme available designed to tackle all of this. It's called Covax, and it's meant to help poorer countries. But it's off to a slow start. Ghana was the first country to receive its doses. They got 600,000. People lined up in the capital, Accra, mostly healthcare workers and others at high risk. The UK government is the largest contributor. It's provided £548 million, but is still choosing to make direct deals with vaccine suppliers. Originally, Covax hoped to deliver 2 billion doses to countries across the world by the end of 2021, with most of those going to the world's poorest 98 countries signed up to the scheme.
The purpose of Covax is that states pay into it to ensure that 20% of their population will receive doses. The other reason you pay into it is to make sure that you get access to a vaccine. So, for example, the UK government will pay into something like Covax to invest in research and development for a COVID-19 vaccine, while at the same time engaging in more bilateral agreements with pharmaceutical companies. So you both pay into the global institution and you also do your bilateral kind of deals. Some of the problems around this is that people think that it's not fair. So in the sense that people like the UK or states like the UK are paying both into the global institution and at the same time having these sort of kind of bilateral deals on the side as well. There's nothing to stop states doing this if they do pay into Covax, but it is a kind of controversy in that respect.
But when Covax published its first distribution forecast, it shows it aims to deliver just 330 million doses in the first half of this year, a fraction of the original goal. If those vaccines were shared equally per population, there would be enough to vaccinate 3.3% in each country participating in the scheme. The COVID-19 vaccine was developed and manufactured at a record pace, but that speed was paid for in part by wealthier countries, which has given them more leverage and moved them to the front of the queue now the vaccines are ready. But there will be consequences if only the wealthy get to vaccinate properly. Current projections show that the world's population won't be vaccinated until 2023 or 2024.
If you leave it for 5 years, it's late because of the deaths that will happen. It's late because of the heavy impact on the health system, which means somebody with another disease won't get treated and might even die. So even the dying and the suffering is not necessarily directly because of the people are infected by the virus, but it's the impact of the virus on the health system.
We know the pandemic is a global issue. We've seen how fast the virus spreads around the world. If it's only wealthy nations who are able to get their vaccine programs up and running, then the virus will stay with us for much longer and could cost even more lives.